Hello, everyone, and welcome to our webinar today on economics, equity, and inclusion in early care and education. We have recently started a series looking at impacts on the field of COVID-19 and also beyond that, because what we've seen, of course, are that issues that existed before the pandemic have now worsened in many cases. And so, we thank you again for joining us, and I will turn things over to Brian to kick us off.
Great. Thank you, Mary. And Mary, if you can still hear me, can you still hear me? I just switched to a different audio source. Okay, great. All right, just a couple of quick housekeeping notes. We've got a lot of folks on the line today, so we're going to leave all of the attendees muted, but we will be watching the question and answer window. So feel free to ask questions through there, and we'll try and catch them along and along. We'll also have some time at the end for questions if folks have any at the end as well. And also, I think this probably pinged you when you signed in, but in case your speakers weren't on just yet, this is being recorded, and we plan to post the recording afterwards. Just to walk through quickly what we'll be going through today, we're going to look at the macroeconomic forces that are in play in the early care and education field, the implications of those forces on equity and inclusion, the impact of COVID, opportunities for policy change to help us build back better, and then an opportunity for some discussion. And during the discussion, as we have time, we can also, if you raise your hand in the Zoom tool for raising your hand, we can try and include others in the discussion as well. Just a quick note about the Institute for Child Success. For those of you who are new to us, we're a research and policy organization focused on the success of all young children. And a lot of what we do is partner with communities who are trying to tackle various problems that have implications for young children. So improving kindergarten readiness, improving health outcomes, birth outcomes, and that sort of thing. And of course, as we have been doing that work over the years, economics has been a pretty key feature of that work. So as one example, earlier in our time as an organization, we did an economic impact analysis for the early care and education space, specifically in 2 states. It was South Carolina and North Carolina. We've also done work on things at the intersection in sort of a different direction. So for instance, we had a monograph on the academic impacts of the earned income tax credit, which are really quite extensive. And I'd be happy to go into that with anybody who wants to discuss afterwards. That's a little afield from our topic today. And we've also worked with organizations and with local jurisdictions doing a deep dive into I'd say the microeconomics of early care and education. So for instance, we've helped one nonprofit create a business plan to start up a new early care and education center with high quality. We've worked with a small jurisdiction, medium-sized city in the South, to help them understand the macroeconomics of the centers, which involved us doing a deep dive into several centers' economic business models in that city. We're going to be discussing some of that in a little bit. But in any case, between those types of projects, we've gone pretty far into the books of a number of different early care and education centers. And so that's part of what's informing the stuff that we'll be talking about here. So let's see. Okay. First off, this is not going to come as a surprise to most of the folks on the line. The fundamentals of the economic structure of early care and education are pretty straightforward. They're not necessarily very positive, but they're pretty straightforward to understand. First off, early care and education is expensive. It's got high adult to child ratios, especially in the younger years. And so you have, a staffer for every small number of children, and that staffer needs to have a living wage in order to sustain themselves. So that's element number one. It's just expensive, especially on staff time. And then the second point is that, many families who need early care and education in order to work also cannot afford that early care and education. So, we're going to get into some of the stats in a minute, but it's for some families, it's for one kid, 35% of their income is early care and education. And that's just not sustainable for families. But the other element of this is it's incredibly valuable to society. And so we're going to get into some of those details here. And again, for folks in the field, this is not going to be terribly surprising. But there's the Heckman study that shows you get a 13% annual return on your investment when you invest in young children. There are studies like the one on the screen looking at high quality preschool. And these are, let's see, this is from the Carolina Abecedarian Project and its sister program, the Carolina Approach to Responsive Education, so CARE and ABC. And these impacts are tremendous, and these are impacts that any government or society should really want to advance. So longer lifetime earnings, more likely to graduate from college, more likely to be employed, more likely to graduate from high school, less likely to commit crimes. These are really impactful, and we've even seen recent studies from, I think it was Abecedarian, but it could have been Perry Preschool, that now that those cohorts are in their 60s and 70s, we're seeing that the difference means difference in cardiovascular disease and longevity. And so these are really impactful. And so when you look at those three forces combined, that it's very expensive to provide, families cannot pay for it, and it's high value to society, you basically come to the classic definition of a broken market. So you have families who are struggling to make ends meet and pay for it. You've got competition from other fields that are stealing staff away because you can make a lot more money working elsewhere, and as a result, you can only push expenses up so far, which means that families are priced entirely out of market, and the turnover is very high. So that's something that I think anyone working in the field is gonna say, well, duh, this is what we have been living with for a while. So we're going to get a little bit more into those specifics here in just a second. And first off, I would like to ask you all some questions. So we're going to start off. We're going to do a couple of really quick polls. And so for those who have stepped away from their screen, the first poll that's up there is, how much does a low-income working family spend on childcare as a percent of income? And if you were paying very close attention, I might have forecasted that. All right. Let's see, still got a few votes coming in. We've got about 70% of the folks on the line have voted. So we've got a couple in here for 10% or 14%. The next highest is 65%. And it seems like most folks, about 2/3 of the voters, are saying it's at about 35%. And so this stat came out of a study from the Center for American Progress, and they surveyed families. And for those who are making under 200% of federal poverty line, the average is about 35%. So the average family with modest or low income is spending fully 1/3 of that income on early care for their young children, which, as you might imagine, is not sustainable. Another point that came out of the study: 2 million moms out of the country in just 2016 made career sacrifices because they could not access or afford care. And that's just in 2016. So this is something that is obviously only affecting a portion of American families at a time, because we only have young children for a certain period of time in our lives. But that is still an enormous impact, and it's an impact that essentially hits moms to a much higher degree than it hits fathers. Let's see. I'm going to do one more quick poll here on, let's see, there we go. So the first question in this poll, there are two questions on this poll. So after you answer one, we'll talk about it, and then real quickly on two. And the first question here is, what is the national median salary for early care and education teachers? It looks like it's allowing you to do both of these polls at the same time. The second question is, what is the national median salary for a kindergarten teacher? All right. Looks like we've got most of the votes in. So the options that we list here range from 18,000 to 75. And almost majority, a plurality of attendees chose 20,000. And the next most popular answers are 18,000, 25,000, and 36,000. The median salary is 20,000 and change. I think it's 20,000 and a few hundred, which is for most communities, it's half or worse than sort of the average median salary for the community or the self-sufficiency standard. Typically, when we've been working in communities, it works out to about half of the self-sufficiency standard estimates for what it requires to live in that community without needing to get assistance from the public sphere. And then what's the national median for a kindergarten teacher? The median answer here is 35,000, with about a little under half also saying that 35,000 is the right answer, with the next most popular are pretty split between 20, 25, and 52. Now this is obviously also going to vary a lot by community, but the average median salary for a kindergarten teacher is 52. And so what you're looking at here then is you have median salaries for folks teaching 4-year-olds that are, 20%, or I'm sorry, that are 40% of what they could be making as a kindergarten teacher. It also compares in other settings to, let's see, it also, the economic pressure there on staff is quite a lot higher because you also have a starting salary at places like Chick-fil-A and Starbucks, which are comparable to the $20,000 a year that you would make as an average salary for early care and education. And so there's just tremendous pressure to leave the field just for strict economic reasons, because it's not a sustainable salary to live on. And there are opportunities for either quite a bit less stress and also significantly more money and benefits in fields across the country. So that puts that tremendous pressure on the centers because they've got families who cannot increase their payments, and they've got staff who cannot reduce their salaries. And that leaves many people priced out. So speaking about the amount of families that are priced out of the market, this used to be actually a bit worse. So in 2014, 2015, the rule of thumb was that about a third of families of working moms, specifically, about a third of working moms had a center-based arrangement for their kid that was a regular arrangement. About a third were using family, friend, and neighbor, and were able to secure a regular place for their kid through that. And then about a third of working moms with young children simply did not have any regular place for their child while they were at work, which that's a definition of stuck between a rock and a hard place for those families. Now that got better in 2018. The federal government increased significantly the funding for CCDBG. Also, many communities have been recognizing this phenomenon and increasing their funding for either preschool or for early care and education, even in younger years. And so that has gotten better. And the most recent data that we've seen is that it's gotten to be about 50% of families who are working have access to a regular arrangement for their young child through a center. About 25% have it through a family, friend, and neighbor, and about 25% do not have a regular arrangement. So they're working on they're figuring out their child care week to week.
Brian?
Yes.
Before you go on, I want to mention, ask this question that was in the Q&A. They're interested in the impact of the pandemic on the child and adult care food program and food access for vulnerable families. I know this is more for child care.
Right.
I don't know what you want to say to that, but we do have a blog written about it on our website, instituteforchildsuccess.org.
Lisa, I'm going to get to that in a little bit when we go into the section on COVID specifically. But if you don't mind, could you pull up that blog post and pop it into the chat window to attendees?
Sure.
Thank you. All right. So one of the things that these forces have led to is that individual centers have some fairly widely varying financial models. I mentioned before that we did a deep dive into financial models within a single city. And so we put the sort of low end and the high end on this chart for providers in that city. And I'm being vague about which city it is because those results are not yet published, and so we're waiting until they're published to say where that was. But it's a medium-sized southern city. And so as you can see, as we know, infants are costlier than 4-year-olds, obviously. But what's often not intuitive, especially to policymakers, is just how much more expensive infants and then toddlers are than 4-year-olds. And this is a very significant force on the macroeconomic side as states and jurisdictions are expanding preschool for 4-year-olds and 3-year-olds. So as you can see here, the high end in this city was spending about $16,000 per year on infants through 2, and then on 3-year-olds, about $7,500 and about $6,400 for 4-year-olds per year. Compared to the low end starts at $13,600 for infants and goes all the way to $4,200 for 4-year-olds. And then we also crunched for those who are interested in the less than 3 and the 3 and 4-year-old together, or 0 to 5 in aggregate. So if you look at the 0 to 4 or 0 to 5 in total, we're talking about a range of expenditures per pupil of $6,300 to $9,300. And then, of course, there's wraparound and extended hours services. And so those also vary widely by center. And in this particular community, even the lowest expenditure was spending about $1,100 per kid per year on wraparound services and extended hours. The higher expenditure center was spending $5,200. So I want to also note that this particular study, we were only looking at high quality centers. And the definition of high quality in this community was if they had maxed out their state's QIRS rating. So both of these centers had a top level quality rating. Now we can have separate discussions about how those quality ratings match to outcomes. Much of this particular state's quality rating was based essentially on the credentialing of the staff. And so those are also pretty tightly connected to the salaries of the staff. So one thing that, as you might expect, the lower expenditure centers, they were able to maintain the required staffing and credentialing ratios, but they also had very significant staff turnover. And when you look at, we're going to get into in a minute what that means for kids' brain development, but there's some very significant impacts and inequitable impacts of that high turnover. And there's also significant equity implications for how they manage to bring the cost down. And essentially, they're doing it on the backs of their team. for whatever reason, their team is able to or needs to be employed at this rate, which means that their other living expenses are getting either deferred or they're leaning on other family members or services to pay for those expenses. Which brings us into the conversation about equity and inclusion. So I do want to, excuse me one second, I've got a screen hiccup, so I'm switching to paper. When we did the study, and I'm actually going to pop back to this slide for 1 second. When we did the study, the question that the city was posing to us was, how much would it cost to expand services in an equitable fashion? And so they really wanted to understand the true cost of care, including the cost that under its current market were being borne by the staff at centers. And so we worked hard to account for hidden costs. And one of the proxies that we used was the self-sufficiency standard, and how much would it cost to bring up the salaries of the workers to that self-sufficiency standard. At first, we were thinking that we were going to need in this particular community to do a more competitive structure where we were looking at what their best alternate job would be. For instance, a kindergarten teacher in the public schools. And as it happens, the self-sufficiency standard and the entry wage for a kindergarten teacher and competitive rates in other fields all kind of coalesced at about the same salary. So when you take that, you can crunch out this third column that you see on the screen, which is a sustainable and scalable cost for early child care and education. And if you hop down to the 0 to 5 in aggregate, you're looking at about $11,000, which is, a full $2,000 per kid more than the highest expenditures in that city, or about $5,000 per child more than the lowest cost was spending per child. And I want to go back up a little bit further to the less than 3 years old and the 3 and 4 year old categories. And this is where the macroeconomics of preschool get really, really interesting. And that is if the public space provides for 4-year-olds and or 3-year-olds, then you wind up taking out the least expensive of the children to serve for these centers, which has the benefits, you could say, of making it a shorter window of time for families that are having to pay for private care. But it also has the side effect that the average cost per kid goes from $11,000 up to $16,000 to provide a sustainable and scalable cost of care, because that's more the average of the sustainable cost for infants to 2-year-old. And so, as you can see, that poses some real challenges to that gap, where you had families already priced out of the market to the tune of about a quarter of families right now. So if that was all that happened, if all that happened in a community is that they provide public 4-year-old or 3-year-old care, then that poses a real threat to families on the margins who have 0 to 3. And it also poses a real threat to those providers who are more financially on the margins. However, there are some real opportunities in that scenario with CCDBG and the like, where there is funding available for the entire early care and education space that then also does not have to spend those resources on 4-year-olds. So we're going to get to talking about that in a minute. I just wanted to mention it here to say it's not an unmitigated bad thing for the field for 4-year-olds to get publicly provided care. Let me see, making sure there aren't any questions. Okay, great. So I want to talk a little bit, and we'll just leave this up on the screen, about some of the other implications for equity and inclusion of this set of realities. So first and foremost, with the staff, Compared to the population, the staff at early care centers is dramatically more filled by women, and 40% of the field is staffed by women of color. And I'll also add that when we're looking at these models, very few providers are providing health benefits. And so on top of the reduced wages, we also see that these women and women of color predominantly who are staffing these centers are also less likely to have health insurance coverage, at least through their employer. And so you take that and then you move towards the family dynamics. For families, when they are unable to access care, disproportionately women bear the brunt of that in their professional lives. We also saw in the Center for American Progress study another concerning stat that the difficulty locating care is not equally borne either. So women of color are significantly more challenged in locating early care and education and accessing that care than other families are. And so we see that equity and inclusion dynamic bearing out there. And then this is something that's especially anybody on this line who has talked to me for more than an hour has heard me say something about positive and reciprocal verbal face-to-face interactions with stable adult caretakers. This is the secret sauce of the brain science. So when you have kids who are able to get lots of positive reciprocal verbal face-to-face interactions with a familiar and safe adult, their brains grow, they develop more resiliently, and they develop more robustly. So when you're looking at this, the second column for the low expenditure sites, when you have situations where these kids are in places that are rated as very high quality, just like this one was, but they have significantly high turnover, the kids aren't able to develop the same level of relationships with familiar adults because the adults are new. And that has real developmental impacts on those families. And because these are centers that have generally some lower fees, those impacts are entrenching and exacerbating existing structures of inequity. So if you have families who are already suffering from systemic inequity, these dynamics are bearing out with a multiplier effect for their kids. I also want to mention there's a significant effect on small businesses with this one. The larger businesses can afford to provide greater supports, either through things like extended leave, parental leave, or through direct child care supports. While smaller businesses typically struggle more on the financial margins required for the financial benefits, but also the workflow benefits are more challenging with having members of your team go out for parental leave. So there's an additional innovation challenge that is exacerbated here. And all of these wrapped together, these are things that have been in play now since the beginning of this field. They're not new challenges. However, one of the things that we're finding in the current moment is that lots of folks are starting to recognize it in a way that they weren't before. And one of the things that we're hearing a lot from families is, yeah, when we went through that, it was incredibly tough, and then we just got through it and kind of went on with our lives. And this is the closures of schools, the closures of childcares has provided a refresher, I think, for a lot of folks who had forgotten what it was like to not know where your kid was going to be. And it's bringing these challenges to light in a way that we haven't seen before. And we do think that there's some opportunity there to help bring some public attention to the challenges that are needed. We're seeing a question here from one of the attenders. is there really any solution other than adequate public funding? And we're going to get to the solutions to some solution discussions in a minute. I will say that adequate public funding is one that keeps coming up. But there are some, especially in the sort of business space, that we're going to discuss that can also be very interesting. And there are also some models from other fields that have dealt with this type of broken market for a public good in places like higher ed, healthcare, and the like. So we're going to get to that in a minute. But they don't all come back to public funding. Public funding is certainly one of those that is top of mind for a lot of us. So this is the market that existed in February of 2020. And then, of course, the world got turned upside down a bit. And we've already discussed that prior to COVID, these dynamics were starting to gain more recognition. The federal government doubled its investment in early care and education. States were also seeing significantly increased impacts. And so it got up to the point where we were only seeing in sort of this classically broken market about a quarter of families who had to have childcare and could not afford it. And so that's still a bad market, but it was getting better. The point is, it was still very fragile when COVID struck. So when COVID struck, we were sought to, some folks approached us about conducting a survey to examine the economic impacts in South Carolina specifically. So the data that I'm about to show is largely from the South Carolina study that we just concluded. And Lisa, if you don't mind, if you could pop a link to that as well into the chat window. But it's also fairly in line with other similar studies that have been done across the nation. One of the reasons we did this in South Carolina is a lot of the national studies had a very small sample size in South Carolina, so they wanted to dig a little deeper just to see if the trends were different here. But there's a lot that's fairly comparable. And of course, one of the first things that we saw is that a lot of centers had to close. And for reasons which we're all familiar, parents were home from work, they were laid off from work, and also they were concerned about infection. So about half of centers in the state were closed for all registered families. About 40% were open for all registered families. And then in between there, you had some who were open for first responders or the like. And then we also had a sliver that was open, but was anticipated closing in the next 2 weeks. And this is where the financial fragility really came into play. So we also asked, how long could your center financially survive a closure? About a third could not handle any closure at all. And about another third did not know. And this is something where a lot of early care and education providers get into it because they love working with young children, and it's not necessarily because they love running a business. There is some of that, but we see a lot of challenges in understanding how long you can forecast out operations if you were to shut down. And then in between there, we had centers that had 2 weeks or 1 month or several months. I will note that a very small number thought that they could last several months. It was 9%. And then there was about 25% who could last somewhere between 2 weeks and a month. And actually, before I come off of this slide, I also want to note that among centers who reported that they were open for all registered families, 79% of those reported that they either could not financially handle any closure at all, or they weren't sure how long they could remain solvent if they closed. And this is an important feature, especially from the equity and inclusion perspective, because we had centers who were more financially fragile. And as a result, during the pandemic, we're trying to stay open. by and large, the more financially fragile centers also are not as likely to be offering healthcare. And so you have a significant burden on both the centers and on society when decisions about whether or not to stay open during a pandemic are not able to account for the public health implications of that in the same way that centers that are more financially resilient, that have some clarity that if they did shut down for public health reasons, they would then remain solvent and be able to reopen when folks wanted to go back to work. Let's see. I'm just checking here in the chat window and making sure that I'm not missing any questions. We've got Lisa did put in the link to the full study. When you look at the economic losses by center, those of you who have operated small businesses, you can see that these are game-changing losses. And this is not different from a lot of small business sectors. You see similar discussions of impact on, say, for instance, restaurants and the like. But the current loss for just the first month is estimated at about 22,000 per center. And the projected loss for April 15th to May 15th was about 31,000. And so this is why it was such a significant fragility for the field. And so now we get to some opportunities for policy change. So the good news is that there are some examples that we can go to that talk about what we can do. Again, this is a classic broken market, which means that there are some exemplars. So, for instance, in let's see, global education systems. Going back to the question earlier from the panel about public funding. So, first and foremost, there was a National Conference of State Legislatures, which, for those of you who aren't familiar with this organization, is a very trusted and trusted from both sides of the aisle organization that advises state legislatures across the country. Their membership, in fact, is state legislatures. They did a study of the highest performing education systems in the world in 2016. And that report, by the way, is fascinating. I highly recommend you dig into it for some fireside reading. But one of the things that they noted of the three core strategies that these highly effective education systems used, one of them was a strong emphasis on early childhood. And we were fortunate to catch a video testimony from one of the authors of this report, where they were testifying before a Southern legislature. And he was asked, so do these other countries spend more per kid than we do? And they were asking it in a K-12 context, because it was part of the K-12 reform discussion. And the author said, well, no, they spend about the same as we do. But in these other countries, they structured their expenditures very differently, and prenatal services through age 5 accounts for about 1/3 of their overall budget. And this is that's something that is just not. We've been asking around ever since in communities across our country, and we haven't found one yet that comes really close to that level of expenditure. So there is a place, I would say, for a discussion of more robust public funding outright. However, there are other examples too, where we could look in the higher education space. There are opportunities for things like in higher ed, we structured it around Pell and Stafford. So it essentially created something of a sliding scale for higher ed. Now we can get into why that there are pitfalls to that type of structure for sure. But that is one option as we're coming through to looking to how to rebuild. There are options for that type of financial structure. There's also an exemplar in healthcare where insurance is used to spread the burden over the population. So in healthcare, you know, there are a lot of people at any given time who don't need to spend a lot of money on healthcare. And then almost everyone in society at some point needs to spend quite a lot, or at least has healthcare needs that are very, very expensive. And so insurance is the classic model for spreading that out so that it's not as much of a feast and famine situation. So you could look at something where that type of structure is engaged. But those are relatively significant shifts. Either of those three are very significant shifts, either just straight public funding or financing options that spread out the burden over time, or an insurance type model. In the US, I think we're going to see a lot more engagement around some that seem like lighter lists than that. Obviously, there's the Child Care Development Block Grant, which I know we have a lot of folks from South Carolina on the line. That's the main funding source for ABC Quality and SC Voucher from the federal government. But it's also the primary funding stream for most QIRS systems and economic supports to working families for childcare in states across the country. As mentioned before, it got a doubling of its funding in 2018. And we threw a nice party over that. We were very excited about it. But even with that, so before that expansion, we were serving somewhere around, as a country, somewhere around 10% or less of kids were able to access funding through CCDBG, of eligible kids, so of low-income working families. So during the COVID crisis, that fund got a very serious shot in the arm. I think it was several billion. It was essentially, it doubled again the amount of funding in that. And in the current proposal, it would receive another $9 billion. So for instance, in South Carolina, that translated into about $63 million for that one state in the first round, and would translate to probably 90 or 100 million of funding in the second round if it passes as it looks now. So CCDBG expansion, that's one way to look at public funding, really targeting working families, at, 200% FPL and below, with priorities for those who are on TANF or in foster care or the like. Another option is one that we pulled from Louisiana, and it's called the School Readiness Tax Credit. Louisiana's version of this tax credit has 4 tax credits associated with it. One, and it's a fantastic project, and so we only have a few minutes to discuss it here, but happy to discuss offline with anybody who wants to follow up. The first is a tax credit to early care and education providers themselves. So the businesses, it's a tax credit, and it's tied to your quality rating in Louisiana. So if you're enrolled in QIRS, you're eligible, and the amount of tax credit you receive is higher. The higher up the quality ladder you go, with the top 5-star getting the best result, or getting the best credit. There's also a credit for provider staff. And so this was viewed by the state afterwards, after they launched it, as one of the most effective prongs. And what they were hearing from providers, especially those who had not been enrolled in the QIRS before, is that their staff were coming and yelling at them, telling them to get enrolled so they would qualify for this credit. And so it provided a real incentive for providers, because it provided a real boost on income. The next credit was for families who enrolled their kids in the QIRS. And then the final credit of the 4 was for those families' employers. So in much the same way as employers can provide healthcare supports as an employee benefit, there was also a tax credit for those employers who might do that for their early care and education, and they could even use the FSA fund structure that they had as part of their healthcare benefit structure. And so what they found was that this was an incredibly effective tool. It injected a lot of funding into the economy because it was going to folks who were, needing to spend that money right away. So it had a multiplier factor, and it was also providing real incentives for families to enroll in higher quality centers because they got a higher tax credit, which provided a real incentive for centers to both enroll in the QIRS and also to move up that quality ladder. And then, of course, the staff got the economic support that was a boost to them. Again, because we have a lot of South Carolinians on the line, I do want to mention that this is a proposal that has been put forth to the legislature before. And it got some traction. It was not yet enacted, but it's certainly something that states across the country are considering. I'm going to take a quick pause here and look. We've gotten a question through the chat window from a staffer, and yeah, say that again.
Two, actually.
I'm sorry, I missed what you said there, Lisa.
There's two, actually.
There's two. Okay, thank you. And I'm just going to read it here out loud. The first is, through my experience providing business practice training, on-site technical assistance, and consultation, a large majority of early childhood programs don't have a stable business plan and/or financial plan for an emergency. Many times, staff payroll is supplemented by the owner's personal savings account. And this was also something that we were hearing in our feedback from centers and sort of the open qualitative section of the data. Part of the reason they didn't know how long, for some centers, how long they could stay afloat was because they weren't sure how long their personal savings would continue to support that center. And so it goes back to that point of the reason that these centers are able to operate at these below market prices in many cases are because there's a real dedication from the staff and the providers. They get a great sense of value out of doing the work. That's not an equitable reason to not provide fair market wages and living wages, but it does bear out in fragility in times of crisis. The next note here is that the CARES Act emergency operating grants for child care providers application is now available on the scchildcare.org website. So again, for our South Carolinians on the line, ICS is headquartered in South Carolina, so we do get a higher percentage of folks from South Carolina coming to events like these. Yes, scchildcare.org. They announced, I think it was last night, it went live, operating grants that come from that $63 million that we discussed from the Child Care Development Block Grant. But scchildcare.org has access to grants. I think they range for centers between 10 and 15,000, and family and home care providers can apply for up to 5. Got another question here. Why didn't the tax credit pass our legislature in South Carolina, and what needs to happen? That is a long discussion, but I think I'm going to try and boil it down to a few seconds. Essentially, the question was, it was difficult to predict how much it would cost and difficult to find that funding. However, at the time, we didn't have that additional doubling of CCDBG, so one option for expansion is to use a tool like that to fund the credit. So it could be, it may not come from the State Department of Tax, but it could come from a funding stream like the CCDBG. But I'll also add that when, just from a sort of rule of thumb on advocacy, it's very unusual for a new idea to be passed by a legislature. And even though this wasn't a new idea in a general sense, it was new to them. And so it was introduced a couple of years ago, and I think it has some real promise in years to come, and especially given the increased attention and pressure as we're trying to reopen an economy, and parents don't have a place for their kid to go while they go back to work. We're hopeful that this type of tool may be useful as we move down that road. Let's see. Also wanted to mention, in states across the country, one opportunity here is increased paid family leave, especially in those states that are considering expansions of preschool. When you look back on bounce back to way back here to this chart. You know, if you're seeing, if you're working in a state where you're taking out this 4-year-old with universal preschool, if you can provide state opportunities for paid family leave, especially parental leave rather than just maternity leave, from the equitable position, then you can at the same time as you're taking off the lowest cost students, you can take the highest cost students off the burden of the center, and that would drive the costs significantly, and drive them down significantly. So that's a consideration both from a public policy perspective, but also from an employment perspective. So for businesses, which leads us to competitive tools provided by businesses. So going back to the question of, is this really just about funding? I think a lot of this goes back to public funding. It could also go to public finance when you look at things like insurance or loan models. But there's also a significant role to play by businesses. And, you know, the National Chamber of Commerce has picked up early care and education as one of its core policy priorities. And I believe that started last year. We're also seeing that in chambers of commerce across the country. Now, we haven't fully recognized how that's going to pan out in COVID. As an initial matter, you know, in February, they were really concerned about early care and education, in part because they were having a lot of trouble identifying enough workers for the jobs that they wanted to hire. And so, you know, I think there was where we're headquartered, the Chamber of Commerce in Greenville, South Carolina, they issued a survey to all of their businesses. And when they asked about what is the number one driver of employment challenges that you're facing, the third one was lack of access to high quality early care. And so businesses have started getting engaged in this conversation from really that perspective of either identifying workers or retaining workers, how they can get access for their team for high quality early care. Now the dynamic has changed a bit, right? In that the employment pressures, we have higher unemployment and more difficulty bringing on more employees because our revenues are down. But at the same time, right now anyway, in South Carolina, we have about a third of the early care and education supply in force that we did. And, you know, half of the centers are at least temporarily closed. Those who are still open are operating at a lower capacity. And so that's where we get to about a third of the sector serving about a third of the kids that they were before. We're not sure how much of that is going to return. And we're not, so at the same time as employment pressures are dropping, the supply of early care and education, at least for the moment, is just gone way, way down. And so we think that this is an opportunity for businesses to be part of that solution. And we've seen some examples of that. You know, we've heard of partnerships between early care providers and first responders, so hospitals teaming up with early care providers to make sure that nurses and doctors and others in the healthcare profession are able to come do their very critical work. And you see that with states doing things like these grants for emergency workers to have access to sports. And I'm sorry, I'm veering off of the business discussion. So there are a few different tools that they have at their disposal. One is that, like the hospital's example, you can enter into a business agreement with the center to provide preferred or guaranteed slots for your employees. And in that way provide sort of a sustainable demand, which helps increase the stability of these centers. Another is direct financial support to employees as a benefit. This is a really low cost financial benefit for the business overall, because at any given time, you have a smaller portion of your employees who have young children. but it's an incredibly high value benefit to those employees. And so it generates both stability for young families and also a sense of loyalty to the employer, and also it reduces their stress to allow them to focus on their work when they're at work and not be worried about where their kid is. We've already discussed parental leave. And then finally, a more flexible schedule. So what we see with a lot of families who are in this situation is that, childcare is a scheduling challenge if you have inflexible schedules for the work, and having the ability to shift your schedule an hour to match that early care provider that is the quality provider either near your office or near your home makes a big difference. All right, and let's see, we have some additional questions here. One of them is, centers are concerned that they opened, but they will not be able to sustain being open since families are not using the services. It's a catch-22. And yes, that's also something that we heard from the feedback, that part of the calculus is, will the families want or need our services? And frankly, that seems to be I would love it if centers were making those decisions based on that and public health needs, and not based on, can we pay rent if we close? And so it seems like having more financially resilient centers would be in all of our interests as we're trying to reopen. We have another, and I'm just going to read this. I haven't processed it yet. Yes, the chambers have been saying that for years, yet they remain remarkably regressive. If childcare is a broken market, I'm not sure that relying on market strategies will make a huge difference. I'm skeptical that relying on individual fixes to systemic problems is going to get us where we want to be. So much of this seems to be tinkering around the edges of a system that just doesn't work as currently constituted. And so I would not challenge any of that. We did want to mention the business options, because in the event that the systemic changes are slow to happen or don't happen, these are tools that communities especially can deploy in partnership with their business community. But I would not dispute that these are systemic challenges that we're going to be suffering from until we have systemic solutions for them. And from the national advocacy perspective, a lot of the conversation has been around something along the lines of CCDBG, but maybe not that particular program, but something that does provide real meaningful financial supports for working families so that the market can operate as a market with sufficient financial demand to match the need. And we've heard one of the things that happened with the most recent proposal, some are calling it CARES 4 or COVID 4. The advocacy community was asking for, I think it was $53 billion for that program, which would be an order of magnitude higher than it was in 2019. So I think the funding for CCDBG was 2.4 billion, and they were hoping to bring it up to 5 billion before COVID even entered into the radar. And so, those are sorts of options that would seriously change those macroeconomic forces and would provide an opportunity for the systemic solution to be more of a market-based solution. You also see in other countries where some other countries use a market-based approach. Some of them use more of a single payer approach or a direct provision of services approach for various pieces of this market. One of the best functioning early care and education systems anywhere is the U.S. military's early care and education system, and so there are models there where it's not necessarily the market solution, but that market-based solution does seem to be the type of solution that is most amenable to policymakers in the U.S. at this point. And we have a note here that the number of advocates asking for is 50 billion. And I think there was a lot of surprise from the advocacy community when the proposal that was released came out with 9, because 50 would have been a real shot in the arm for the economy at large. And 9, I think the consensus is that might get us through June without complete collapse of the infrastructure. But it's not the sort of sustainable solution that I think a lot of advocates were hoping for. I hope I'm not speaking out of turn for any advocates out there. And then we have one more note here. Has ICS ever done a study on parental leave? Also, do you know the rate or percentage of employers providing parental leave specifically in South Carolina? And we do not have I don't believe we have that stat at least I don't have that stat at my fingertips, but we'll do some digging and see if we can get you something. I see who asked that question, and I'll be sure to follow up with you on that. And then we have another note from a participant. Military bases use a sliding scale for their services. For enlisted families, it still proves to be quite expensive compared to their salaries. And thank you for that note. When I referred to it as one of the best early care and education systems that we've seen, that was more coming at it from a sense of the outcomes. But that's a very good point, that it's still quite expensive, even with the sliding scale. And you know, there's the truism that budgets are moral documents, that it shows where you're putting your priorities, and I think that's appropriate to point out. And then there's an additional note that quality is high, but quality costs, and that is absolutely clear. Going back to just the brain science, positive reciprocal verbal face-to-face interactions with stable and familiar adults, those require the attention of a stable and familiar adult, and to the extent that we can provide more of those, we're going to have kids who are more resilient, with greater development. And to the extent that we have systems that don't provide those, then those systems are going to result in kids who grow up with greater degrees of developmental challenge and less resiliency from a brain science perspective. So I absolutely agree that high quality costs money, and I think our posture is that we should find solutions to provide to resource that, because the benefits are overwhelmingly worth that cost. It's just that right now we're expecting young families getting started to bear the brunt of that cost, and that is that's just not possible for many of them. We are now at 3:03, and so I apologize to those who had to hop off or have to hop off for going over time, but I did want to get in those notes from the participants. So with that, thank you all very much for joining. If you do have any additional questions afterwards, feel free to email, and I thought I had included my email on that last slide, and I did not. But for those who are still on, it's B Burrows, so at BBOROUGHS at instituteforchildsuccess.org. You can also find me or anyone from the ICS team on our website, www.instituteforchildsuccess.org. Thank you all for joining, and we look forward to meeting up in the field as soon as we can come see you all again in person. So thank you very much. Mary, did you have any final notes or thoughts? Or Lisa?
Brian, one thing that I do want to say really quickly before everyone hops off is that we do have 2 more webinars coming up pretty soon. Our next webinar is on Thursday, June 4th, and that is our Health, Equity, and Systems Leadership webinar, which will occur at 2 p.m. Eastern Time. And then we have a webinar also on June 18th at 2 p.m. Eastern Time that will consist of a review of the results from our child care survey. So we hope to see some
you.
of you on those as well. Thanks, Brian.
Yes.
Thanks.
Thank you. Thank you, everyone.